You know, I've been resistant to introduce lasers into our cosmetic dental practice for several reasons. It's not that I haven't been exposed to lasers in the office, because I have. My hygienist has been an advocate for several years of lasers. But on my end of the spectrum, from my part of the practice, you know, in the cosmetic dental side, in the dentistry side, I've found that the lasers just weren't letting me do what I wanted to do in an effective, efficient way. Because I always look at any technology that we get in the office, whether it can help me do what we do better, more efficiently, and more profitably. And for me, the lasers, the diode lasers, were just not quite doing it. I mean, the things that we could use it for gingival troughing, you know, for some of the other procedures for some gingival contouring, the results were slow, tedious. The lasers were not cutting efficiently and effectively the way I'd like. Now I've been exposed to the Alta laser. The Alta laser has changed my mind completely about what a laser can do. Because right now, we're getting results with the laser. The tissue management is fantastic. The speed of the cut is incredible. It's just working so well and so effectively. We had a case the other day where there was, you know, the classic case of some decay, you know, subgingivally around the crown. You know, those cases are always real difficult to manage because you're always trying to get down there, packing cord in there, doing something to sort of expose the margins of the decay so you can get a good fit, feel, and seat of the restoration you're trying to put across there. But I used the Alta laser the other day to do that, and I was like blown away. I've been doing this for 32 years in dentistry, and I just did this, and I'm like looking at myself and thinking, oh my gosh, this is incredible how easy this was. Expose the margins of the decay, allowed us to do a restoration that would fit well and sealed to help the patient to not lose what would have been an abutment for a bridge. So, I mean, I've been resistant in the past, but that's changed. One of the things that we know for a fact is that the Alta laser does come at a little bit more of a premium price than some of the diode lasers on the market nowadays. But once again, I want to refer to some of the things that we look at when we decide what technology to get in the office. Is it going to allow us to do things better? I mean, better in terms of overall patient results, less problems with potentially having to redo things, less problems with discomfort for the patients, just an overall result of things that can be done more effectively and efficiently. And I'm a firm believer, if you have the right technology in the office, paying a certain little bit of a premium price on it is not really an issue at all. Because of the fact that if something works so well, and the Alta laser, in my hands so far, as a person who's been around lasers for a long time, but I'm not going to claim to be an exceptionally skilled laser technician, the Alta laser works so easily. The learning curve is so simple, and the results that we're getting are so fantastic. So it's making us more profitable because of the initial cost, well, it might be a little bit more than some of the traditional diode lasers on the market nowadays, has not been an issue. Because I look at it the same way as we look at employees. I mean, don't worry about how much you can pay an employee. If you have a great employee, she'll pay for herself because she's that good. I mean, so you get more cost loss out of a bad employee who is costing you much in terms of inefficiency, not doing things right or doing things well. But a good employee will pay for themselves. Just like the Alta laser, in the results that I am getting in my hands, it's paying for itself. It's doing things better. The results are fantastic. And I like to look at things and feel good about what we just did. And I like to look at the results and feel like this is the best that I could have done. And the results are fantastic, and they're going to be long lasting. And that's what we're finding with the Alta laser. It's working well, it's working efficiently. So the cost, to me, I mean, you can, you know, bend over a penny to pick up a dollar, bend over a dollar to pick up a penny, that type of thing. But I think the thing you want to look at with the Alta laser is how well it's going to work and how well it's going to make your practice more profitable and more efficient and provide, more importantly, better things for your patients.